Und ich gonna live yesterday. American, Heil Hitler!
What happened to our prisoner?
Still in the water. Look what we found.
Amoeba histolytica is a parasitic amoeba that feeds on living cells in the human gut.
Most of the time, the presence of Amoeba histolytica in the intestines causes dysentery. This is an inflammation of the intestines that causes diarrhea, and in the worst case, severe dehydration.
But in rare cases, the Amoeba histolytica will actually attack the intestinal wall, eating through the tissue. From there, it travels in the blood to the liver. Here, the Amoeba feeds on the liver cells, thus creating an abscess of dead material, liquefying the liver.
Here you go.
The amoeba starts its life cycle as a free-living cyst in the water. When a human drinks contaminated water, the cyst enters the gut. Here, the amoeba emerges from the cyst, divides, feeds, and then re-encysts. When the cyst passes out of the body into the water, the life cycle is complete.
Amoeba histolytica infections are extremely common. Around the world, there are almost 50 million reported cases every year. But only about 70,000 of those turn deadly.
Most infections occur when the victim ingests food or water contaminated with the amoeba. Travelers to tropical regions where sanitation is poor should avoid consuming food and drink prepared in unhygienic conditions, and refrain from swimming in contaminated water.
Amoeba histolytica has a brilliant survival strategy. It steals food from inside its host to fuel its life cycle.
Is this the disease?
We know the disease, but we don't know the treatment. Bring her over! Stop. What's the treatment?
Nine!
Answer me!
Nine! I think she'd rather die than tell us. Or maybe she doesn't understand. You, translate! This is Zao. Nine! What's the treatment? Nine!
What is? Try to look at this. Remember this? see? Alive?
What?
Then tell the fucking treatment!
What's that, Mr. Zhang? Okay, okay.
Many infected people have few or no symptoms. Symptoms that may occur include increased gas or flatulence, cramping abdominal pain, and intermittent diarrhea, constipation, or both. In severe cases, the abdomen is tender when touched and the stool contains mucus and blood. The person may also have a fever, and diarrhea may lead to dehydration. Wasting of the body and anemia can occur in people with chronic infection. Sometimes a large lump or amoeboma forms and blocks the intestine. Rarely, amoebas spread to other organs, including the lungs or brain. The skin may also become infected, especially around the buttocks, genitals, or wounds caused by abdominal surgery or injury. To diagnose amoebiasis, a doctor collects stool samples for analysis. The best approach is to test the stool for a protein released by the amoebas or antigen testing. Microscopic examination is often inconclusive. A flexible viewing tube may be used to look inside the large intestine and to obtain a tissue sample if ulcers or other signs of infection are found there. Ultrasonography, computed tomography, or magnetic resonance imaging can be done to confirm an abscess in the liver, but these tests do not indicate the cause. Blood tests are then done to check for antibodies to the amoebas.
Go.
Where are your pharmacists? I need to talk to them about the medications. Huh? We don't have any pharmacist here. What? You don't have any pharmacist?
If amoebiasis is suspected and the person has symptoms, an amoebicide, either metronidazole or tinidazole, is used. Tinidazole, given in a single dose, has fewer side effects than metronidazole, which requires several doses. Drinking alcohol within a few days of taking metronidazole or tinidazole may result in nausea, vomiting, flushing, and headaches. Neither metronidazole nor tinidazole always kills cysts that are in the large intestine. A second drug, such as paromomycin, iodoquinol, or dilocinide, is used to kill these cysts and thus prevent a relapse. One of these drugs can be used alone to treat people who do not have symptoms but have the amoebas in their stool. People who are dehydrated are given fluids.
Caught in a bad romance. Caught in a bad romance. Rah rah, Roma, my gaga. Ooh la la, want your bad romance.